And tomorrow we are in the operative room to make the operation of these cases. It's a case of resection hip, and the problem is to implant a prosthesis with good condition, because there is a problem of quality of bone on the acetabulum part and also in the femoral, with modification of the bone. And to have a solution for this complication, we can choose a special kind of device of prosthesis to have a good fixation on the acetabulum. And we'll see on the femur part if you use a normal stem prosthesis or special for revision. Yes, the interest in the dual mobility.
Yeah.
In this case, for example.
Oh, no.
In general.
In general, yeah.
Okay. The dual mobility is a French concept that developed in France in a long time, because it's 40 years ago. But it's now a system of prosthesis that is in development in all the world, and increases the number of use of dual mobility in the hip prosthesis. Why? It's the reason. The first reason is because it's a prosthesis that is more in proximity with the natural hip, because we have double articulation with a very big head. There is like the natural head of the femur, and it's the reason why you have the best range of motion with this prosthesis, and also the higher stability. And it's two very important things we want to have with surgery. And its beginning of development international is for the risk of dislocation. And for example, revision surgery, surgery with musoplasty, and tumoral surgery, for example, and old people also. In these cases, the risk of dislocation is very high, and with dual mobility, we reduce dramatically this risk. And when the use is good for this patient, it seems that it will be good for all the patients. And now you have a follow-up, a long follow-up, and we can say that you can use dual mobility in many kind of patients, more than 50-year-old, and also in the young patients that have necessity to have a prosthesis, hip prosthesis, and they won't make sport, because in these cases it's very important to be stable, and also to have a risk of broken, like in the ceramics and ceramic prosthesis. And it's a good solution for the young people with sport practice. It's the reason why the dual mobility is developed now all the world.